Good morning, everyone. I'm so happy to be joined right now on Skype this morning with La Crosse County Health Director Jen Rombalski, who is just going to answer a few of our questions and give us the latest information. Good morning, Jen.
Good morning.
So I wanted to start by having you give us just the latest information on what's going on in La Crosse County.
Sure. So in La Crosse County, at the present moment, we have 24 cases here that are lab confirmed. We also have 17 who have recovered from COVID-19 in our county. We did add one new case yesterday to make that 24. It was an individual in his early 50s with mild to moderate symptoms. We remain having 0 individuals that are hospitalized for COVID-19 and thankfully 0 deaths as well. And with the number of negative cases as of yesterday being 976, that puts our positive number at about 2.4% compared with the states, which is 8.4%.
Jen, I remember a couple of weeks ago when we did our first sort of live press conference with you when the first case appeared, and you very calmly said you expected this and there will be more. Is this about what you were expecting? Is it lower? Is it higher? And where do you think we're going to go from here?
Yeah, so that's a great question. I think that we're going to continue to see small increases. I think that will be incremental. I'm hoping that we don't have a significant jump in numbers of cases, but I do just want, those of us watching to know that that could happen. It's not too difficult if you have an individual who might be in a large household or might be in close contact with other essential workers, that you could have exposures of a number of individuals. It just might be that the number of lab confirmed doesn't jump, but we certainly have more cases in our county than we do lab confirmed.
So here's something that I just have a hard time kind of wrapping my brain around, and that is that at some point down the road, whenever that is, when we lift the stay-at-home order, and there are still cases floating around in the United States, what is going to keep us from going through this all over again if there's no vaccination?
Yeah, I actually worry about that too. I think that I'm afraid that our patience level will run out before it really should. So when we remove this stay-at-home order, remember we have incrementally climbed in cases. We will incrementally decline in cases as well. And if we remove the stay-at-home order, that doesn't mean we can stop doing the other precautions to include some of that social distancing and the hand washing and the not touching your face. Again, if we don't do those things, even after the stay-at-home order goes away, we will have a spike in cases again. And we don't want to have to do that if we've gone through and put our patients in with all of this time staying at home. So that balance will be really critical.
Are you getting an understanding of how people on the federal level and on the state level are going to make the decision to when to remove the stay-at-home order? Are they do they have to be at a certain amount of cases? Is it 0? Where does that fall?
Yeah, that's a great question. I unfortunately don't have a good feel for that. Similarly, I didn't have a good feel for how they were ramping things up either in terms of what they were looking at with when they put the stay-at-home order into effect. So I don't know exactly when that will happen. I do anticipate that we will be extending the stay-at-home order. It'll be great if it doesn't happen, but I'm afraid that if they take it away too early, we'll see a surge in cases, and we don't want to do that. So I just want to ask people to remain patient and stay the course. We are doing all of the right things, and it is making a difference.
We've been hearing from certain folks on the federal level that the next 2 weeks is going to be really critical here. Is that the case also locally?
I don't think that that is the case locally. I've seen some models that have indicated, mid-April that we might see a peak in cases. I'm not really holding my breath for that. I think it's going to be a little bit later. Again, we have seen how much time went by on the coasts, the East and West Coast. And we're continuing to have, about 180 cases per day of lab confirmed cases added to our number in Wisconsin. I don't think that we're going to see a peak of that soon. I think that might be later in April or early May. But again, all of these are just predictions, and they really cannot change the way that we're acting right now. We need to remain staying at home and wearing those face coverings when we're out for essential travel and all of that stuff we've talked about.
As I'm sure you're very aware, Jen, there are lots of misconceptions and just rumors that are floating around on social media about this virus. And I'm wondering if you can talk about some of the things that I've seen and whether there is truth to them or not. I know that there was a researcher, a Yale researcher, that stated that warmer weather could bring some relief to COVID-19. Is there any truth to that?
It's possible, but we just don't know yet if that is true. We've seen that to be true with other viruses, such as influenza. So I think they're making that prediction based upon what they know about other viruses, but we don't know yet if that's going to be the case with this particular strain of coronavirus.
So some researchers are saying about lifting restrictions because of herd immunity. Is that
Yeah.
what is herd immunity, and is there anything to that?
There is just a whole new level of language, isn't there, with
Yeah.
regards to coronavirus? This is how we speak in public health all the time.
Oh, you do?
Herd
Okay.
immunity, we do. So herd immunity really means that enough people in the population, a significant amount, are doing a similar type of activity. So we often use this term with vaccines. So if you have a significant amount of individuals in the community that are vaccinated, the chances that you have that virus or the thing you're vaccinated against, that then wouldn't be able to have such an impact that it would spread widely across the population. So essentially, herd immunity is making sure that you have enough that are doing what you need them to do, to include vaccination or staying at home, to make an impact on the entire population.
Okay. So President Trump has been talking about, and I know that we've heard about nationally, the drug hydroxychloroquine, and whether that's a malaria drug, and whether or not there might be some positive outcomes for treatment in COVID-19. But I know that there's been a lot of discussion that shouldn't be used, that maybe we should try it. Can you talk about that and where that is at right now?
Yeah, so that drug, and actually it has been used locally. So we've had an individual that currently has COVID-19 that has been on that drug. It has to be used carefully. It can cause some side effects that we would be concerned about in particular individuals, especially if they have any heart conditions. So we want to be careful when we use that drug. They don't really know yet if it is significantly impacting in a positive way the outcomes or the length of time someone is ill with COVID-19. I think that's something they're working on and trying. A lot of these things are having to go much more rapidly than normal, and it's better oftentimes to try something if there aren't significant negative effects to it. It is this balance of could it be helpful even despite some of those side effects. So I just don't know that we know that that's been effective enough yet, and we continue to have across our nation areas that are working to explore a better treatment option.
You've been in contact daily with our hospitals here in the La Crosse area. I know we've been hearing that there is a shortage of supplies in many states around the country. What are you hearing from our hospitals locally?
Yeah, I'm hearing that they're okay right now, but again, at any given point, just like with our number of cases, could jump at any point. Same thing with the PPE, the personal protective equipment at the hospitals. They're okay for now, but if they have to take care of a large number of patients, or even one individual who requires continuous changeover of PPE, will cause them to burn through that more quickly than they would like to. So it is a tenuous situation, and they're being cautious with the amount that they have to make sure that it can move through a surge.
All right, my last question for you. So I imagine that there are a lot of really smart scientists across the world right now working to try and come up with some kind of a vaccine. In a usual process of developing a vaccine, how long does that take? And will there need to be trials? And how is that going to work?
Yeah, so just like with treatments, the vaccine piece, it typically takes more than a year to develop that and test it and make sure that it's effective. With everything related to coronavirus, this strain, they are trying to really push those time frames and try to get things out more quickly. So we might see it, in less than a year, but it's still going to be quite some time before we have a vaccine. So again, it's this gap of maybe 8 to 9 to 10 months between now and when the vaccine might, at the earliest, be available. And how do we handle these next 8 to 9 to 10 months? Are we going to be assertive and try to keep us not having an additional surge of cases? Or will we be impatient and remove things and stop doing the activities that we're currently doing? It's just going to be this really tough balance for us to know what to do and when.
So it sounds like this is the new normal for a while, and we should all be vigilant in the hand washing and all of the things that we've been talking about, and wearing masks now when we go out in public until further notice, because we're gonna. It sounds like be in this for the long haul.
I think we are, Jen, and I just want to encourage our, those who live here and are watching this to try to be patient. It is very difficult. It is a different new normal for us, but it is making a difference. And even after that stay-at-home order gets removed, we still need to follow these same guidelines about washing our hands and not touching our face and maintaining our distance wherever possible. So those are going to help us keep the case numbers down and not see a surge in cases.
All right. Jen Rombalski, I just want to say to you on a personal note that you have been, from the start of this, just such a voice of reason and calm for our community, and so much knowledge. And we so appreciate your time and sharing that with us this morning. And thank you for all you are doing.
Absolutely. I'm happy to help.
All right. Have a great day. Bye-bye, Jen.